Josh Bachynski is our speaker tonight. He's the marketing and outreach at Harvest Medicine at Georgian College, and his talk tonight is going to be his medical cannabis right for me, and do I need a referral? How does ACMPR work? And that's access to medical cannabis, access to cannabis for medical purposes regulations. And he's going to be talking about this. And joining him is our medical expert, Faraz, and he can field any medical questions that Josh feels that need to be directed his way. So please join me in welcoming Josh Bachynski.
Thank you very much. So as he said, I am Josh Bachynski. I am the marketing director of Harvest Medicine. Here to talk to you guys today about a few different things about medical cannabis. One, what it is, how it came about, the cannabis plant as individual components, different concerns patients have and how we address them, different contradictions that might indicate you not being a candidate for medical cannabis, what the ACMPR is, and the process of actually obtaining the medical cannabis. So medical cannabis in history, it's been around forever. Our first indications of it being used was about 5,000 years ago. It was used in Western medicine. Oh, question in the back. I'm not using the microphone. I apologize. I knew that was going to be a problem. So medical cannabis has been, or cannabis use in general, has been around for thousands of years.
Let's
perfect.
Help you out as much as we can there. How's that?
That's great. Thank you. So it's been around for a very long time. Our earliest time we have seen it was about 5,000 years ago. It was introduced into Western medicine in the 1800s. In the 1930s and 40s, we saw it run out of favor. There's a number of reasons, some political, some social, but it was, in the end, it was prohibited. Since the 1990s, medical use of cannabis has been expanding, and the knowledge base has been growing. Now it seems almost daily. Medical cannabis, in 2004, approximately 14% of Canadians age 14 and over reported using medical cannabis to treat their conditions, whether it was prescribed by a doctor or self-medication. Patients prescribed medical cannabis for pain-related illnesses report successful pain reduction and use of other medications. So we're actually seeing people being able to reduce their traditional medications. And in one case, I personally have saw one lady who went from 26 pills per day down to 8. That's not everybody, but that was a pretty amazing story nonetheless. 42% of medical cannabis patients record medicating 2 to 3 times per day, and on 40% of those report using 14 grams per week. So when we give you your medical document to access medical cannabis, we actually have your prescription based in grams per day. An average prescription would be 2 grams per day. By no means does that mean you have to use that full 2 grams. That just means you have access to obtain that much cannabis. And I'm sorry if I walked away from the microphone on that one. So medical cannabis and prostate cancer, that's why we're here. First and foremost, it is not a miracle cure. I don't want any misconceptions about that. What we are here for is improving the quality of life. Current medications that are used are Flomax, and it's the main medication because it manages symptoms in BHP and prostate. Faraz, would you mind just elaborating on that a little bit?
Yeah, so I mean, theoretically right now, the main medications that you guys are given for prostate treatment, whether or not it is benign prostate hyperplasia or prostate cancer, is number 1, symptomatic relief, and then there's the therapeutic with radiation and surgery. So when it comes to the symptomatic relief of it, again, that's where we start to group cannabis and specifically CBD into that category. Your number 1 treatment, as he said, is normally Flomax, like your temazicin, all that. And all you're doing with those is, again, restricting blood flow to the prostate and helping decrease the inflammation and the pain in the prostate. So therefore, you're able to get a little bit more flow. CBD works in the exact same way as it will decrease blood flow to the prostate in order to help manage your symptoms better, and as well as increase your flow so that the prostate hyperplasia is not inhibiting to your lifestyle. The other part that we can actually look at is when it comes to Flomax, it's specific to symptomatic relief. There's no relief of pain and the inflammation is still present. CBD and THC combined can, number one, help increase or decrease the symptoms, but also give you a certain amount of pain relief. And that's something that I think is underrated when it comes to prostate cancer or benign prostatic hyperplasia. It's not just about being able to urinate and those type of symptoms, but as well as the pain. And that's where CBD and THC are a great combination, one for the management of symptoms as well as the pain management. So that's a nice feature about cannabis.
I should have just had you come up here. I apologize. So the cannabis plant, you heard him mention CBD and THC. These are the two main components that we talk about with cannabis. Now CBD is the 100% non-psychoactive component. With CBD, you are able to drive and live your life without being impaired. THC, that is the psychoactive component, that is your traditional high. CBD is anti-anxiety, anti-inflammatory, anti-seizure, impairment-free, and a pain reliever, when THC is really that mood booster, anti-nausea, pain reliever, in the sense that it's kind of taking your mind away from the pain, but not actually taking the pain away at the source. And it's also a great sleep aid. Another breakdown we talk about when it comes to cannabis plants are the indica versus sativa. Now, if you're having trouble sleeping, an indica strain would be great for you because that's a much more mellow strain that we actually say indica into couch, because it will actually kind of relax you and put you into the couch. Sativa strains, those are the more uplifting. That would be considered a daytime strain. Now, that's not daytime THC use, that's daytime CBD. If you have nothing to do, you're at home, sativa, THC is totally fine, but we had a couple patients come in thinking that, oh, it was sativa, I could use it during the day and I won't be impaired. Sativa is still impairing if it's THC. But so, again, sativa, just kind of more mentally boosting and a little bit more creative, very popular with like musicians and artists, things of that nature. Parts of the plant we could talk about. A big one is the terpenes. Now, when you smell cannabis, you're generally smelling the terpenes behind it. Now, at the top here, we have pinene. That's pretty clear pine smell. If you've ever smelled cannabis and it smelled piney, it's very heavy in pinene. Caryophyllene, limonene being that lemon scent, linalool being lavender scent, myrcene, and humulene. Now, these are just the main terpenes that we look at, but there are plenty more. Now, these terpenes have the effects that we can see kind of listed to the right here, and they work in conjunction with your CBD and or THC. So we can see some of these are anxiety relief, what else we got? Ulcer improvement, anti-inflammatory, alertness. So some of these just kind of help with the process. So the sativa being uplifting, it would most likely have the terpenes that are related to uplifting feelings like pinene here, because it is creativity and euphoria and things of that nature. Any questions on that one? It can sound a little weird. Perfect. So more on the cannabis plant, the entourage effect and the different cannabinoids. There are 100 plus cannabinoids, THC and CBD just being the two main ones. We're also beginning to talk about CBN and THCV, and the more testing that goes on, the more we will be in the know. Now, the entourage effect, this is a really interesting piece because even if it's a minuscule part of the plant, it can really have a large effect. So there's a story of a test in Israel where they had a bunch of autistic children who were in like intensive care, had to have 24-hour management, and after some CBD treatment, they were actually allowed to go home. After a few months, a few of them started to revert back a little bit, and upon investigation, they found out that, well, the number of CBDs were still the same as they were before. The different cannabinoids behind the plant had changed subtly, and now all of a sudden we're realizing, oh, it wasn't necessarily just the CBD, it was the other pieces of the plant as well. So if you managed to come in and talk to us, our educators would be able to educate you a little bit more on which strains or which producers take out the other cannabinoids. They strip them right out of the plant and just make it a pure THC CBD, or the ones who actually include the full plant so you can get that full entourage effect. Now, cannabis components, THC is the primary psychoactive piece. CBD, it has been known to be that anti-inflammatory, and it works on your CB1 and CB2 receptors. I'm not going to get too in-depth onto the technical pieces here. Yeah, it gets a little wordy and a little technical.
The key to it all, I mean, again, we're looking at the two components, right? So your THC is going to be primarily your immediate pain control, right? So that's like taking your morphine, your Dilaudid, something like that, but not to that extent. Again, we start at a low dose just to give you enough pain control, but not enough to overstimulate you and get you to that euphoric stage. The CBD, the key role for it is inflammation control and, in your guys' case, circulation control. And those are the two biggest factors about CBD that are going to be most beneficial, but you need a little bit of that THC, as Josh stated, to get that entourage effect, to get it to the site, to make it more efficacious and a lot more efficient in the treatment, therefore reducing the amount of the other products that you need and increasing the effect that CBD has as far as the inflammation and flow.
And speaking of efficacy, one of the most efficacious oils that's out there is actually a 5 to 20 oil, where it's 5 THC for every 20 CBD. So they actually added some more THC for that additional entourage effect. Now, methods of use. This is, how do I actually take my medication? Do I have to smoke a joint? Does it have to stink? No. Oil is actually the #1 most used item that we have our patients using. You can just use a dropper and put a couple drops right under your tongue before breakfast, a couple more drops before dinner, or there's even a few different methods where you can have a little spray. It's a peppermint flavor, couple spritz under your tongue, and away you go. It's actually right on price point with some of the dropper oils, so there's really no reason you wouldn't want that extra discretion at that price point. Another way we recommend is inhalation. Now, we never recommend smoking because that is the burning of the plant, and we never recommend that. But vaporizing is the act of blowing hot air over the plant, and it actually releases the oils off the plant, allowing you to inhale them. Now, this is actually better in a number of ways compared to burning it. One, you don't have the carcinogens, and two, you actually get more use out of the plant. So when we burn cannabis, we actually only end up getting about 5 to 15% of the medication because we end up burning it off. But when we vaporize, we actually maximize it and get up to 75% of it. So if you're interested in saving your pocketbook, that is actually one way of doing it as well. And then lastly, cooking. If you want to actually just break down the bud and cook it right into your food, we have a number of recipes. We even have a couple how-tos on our website and Facebook page, but it's very easy. Ultimately, you're just cooking out the cannabis, making it attached to some fat-soluble items, normally butter, and then you use that to just make your food. Vaping versus vaporizing. Because I was talking about vaporizing, I want to be very clear. Vaping, what we see the kids do with the big plumes, that is not medical cannabis. It never is and never will be. That is a very different thing where they use vegetable glycerin, and it ultimately is giving these people popcorn lung. That is not what we are recommending. What we recommend is the one on the right-hand side, where it has a hollow chamber for you to put in ground up cannabis, not these vaping oils. Now, common concerns for patients, the #1, that high feeling. Contrary to popular belief, you don't need to get high. That's what we were talking about with that CBD. In fact, a lot of patients will actually even request a restriction on their medical document so that they don't accidentally order something that will make them high. So it's not uncommon for a patient to ask for a 2% restriction so that they can still get their CBD oil that has a little bit of THC in it, but nothing that would actually impair them to any degree, so they would just never run the risk of being impaired while they're driving, while they're watching kids, while they're watching grandkids, anything like that. The acquisition cost. People think it's going to be crazy expensive because it's the legal system. It's actually not. It's actually pretty cheap. We can even help find you different LPs who will, one, automatically make you or give you a discount of 10 to 15% just because you're over 55. If you have low income, we can help work with you there. The price of the actual bud, there's different options. There's shake, there's indica tips, there's sativa tips. If these are any of your concerns, our geniuses can help guide you in the right direction. The social stigma, that's one that we are actively trying to correct every day. We're so used to seeing, the guy in tie-dye with dreadlocks, and that's the cannabis guy. We're trying to correct that. We come in, I'm wearing a t-shirt, but we try to at least dress up a little bit. When you come into our clinic, I think you actually would recognize it as a very different experience. I have a couple photos of it here, and if you're picturing a traditional dispensary, it is not at all what we are like. And finally, the lack of understanding the route to administration. Many people feel that they just won't be able to because they don't have experience, but we have people coming in, 86 years old, I've never smoked cannabis, I've never touched it, I've never been interested in it, but I don't want to hurt anymore. What can I do? We can help you with that. So a couple contradictions. We don't just give medical cannabis to anybody. Psychosis is a big one, bipolar disorder, any cannabis allergies, they're rare, but that does happen. Pregnancy or breastfeeding, obviously a no-no. And if you have a history of heart or kidney issues. Now that last one doesn't necessarily mean you can't get medical cannabis, but it would most likely mean you have a THC restriction. So you'd still be able to access your CBD medication, but not THC or that high, because it can actually increase your heart rate, and we don't want to put through any undue stress. Adverse effects, these are all the conditions people are used to understanding with cannabis. Drowsiness, feeling faint, fatigue, headache, impaired memory, very common one. Disturbance in attention. These are all things that we can help walk you through and help mitigate with proper education, and particularly with CBD, because a lot of these adverse effects just don't actually come up. Now the ACMPR. What is the ACMPR? Why is the ACMPR around? The ACMPR is Access for Medical Cannabis Purposes Regulations. The ACMPR rules and regulations lay out how many plants you could grow by yourself if you had the access to do so. It lays out the different requirements that the physicians have to follow to actually prescribe medical cannabis. It has different formulas to indicate how you can actually obtain different starting materials and what who can supply those starting materials to you. So it's really just this blanket list of regulations that came in around 2014. Before that, we had the MMAR, which some cannabis places are still trying to run under, but the ACMPR is the new current medical cannabis system. And the ACMPR is pretty vast at this point. We actually have about over 10,000 practitioners who have prescribed medical cannabis across Canada, and we have about 10,000 new patients to the ACMPR every single month. Just some more fun numbers. 2,000 kilograms are sold to patients every month. There's over 100,000 shipments per month, and this number needs actually updated. There's over 250,000 patients currently registered with the ACMPR. So if you're thinking, oh, I'm going to be one of these first people in it, and it's going to be this weird, underdeveloped system, not at all. We have plenty of people who have gone through it and plenty of people who are finding relief through it. Now, if you're like, okay, finally enough, tell me just where I can get it. We are Harvest Medicine. We have the physicians and educators on site so that you can obtain your medical cannabis. At Harvest Medicine, our demographic is actually 50% male, 50% female. A lot of people think, oh, it's just going to be the young males trying to get their medical cannabis. Not necessarily. We are very used to walking through any age of life, any walk of life, through the whole medical process. Now this bar graph down along the bottom, that is actually our age demographic. So yes, there is a little bit of a peak in the late 20s, early 30s, but as we can see, right through the 40s, 50s, 60s, we actually still have plenty of patients. It is a very common place and is becoming more common for people to just learn about medical cannabis and actually obtain. And we actually go from 18 to 98 as our age range on there. So if you were interested in booking with us, the simplest way is to book online. Online, you can actually choose the exact day, hour, minute that works best for you. And I took this just before we came in. There's actually an appointment at 11:15 on Thursday, if anybody's interested. You can do this from your desktop or from your mobile phone. We made it work any way you like. After you book your appointment, we would ask you a simple questionnaire. Now, depending on how you answer this questionnaire, we may ask you another questionnaire, but we do try to keep it fairly prompt and quickly moving. When you actually come into our clinic, we encourage you to explore it. We spend a lot of time improving our clinic, and we take a lot of pride in how it looks. Our CEO actually owns a design company that does work in museums, and I think when you come in there, you would recognize that a little bit. And as I mentioned here, if you ever just want to come in and talk about medical cannabis, but you don't even want to make an appointment or deal with a doctor, you don't want to get that far yet, you're absolutely allowed to come in and talk to one of our Canna Geniuses at any time. We just ask that you come and grab a number, and they will call you up. So when you actually visit with our medical staff, it is a two-stage process. So first we have a medical intake staff who will kind of take down your history, cross the T's, dot the I's, answer a couple questions, and then the prescribing physician will actually visit and answer any additional questions, make sure everything was covered appropriately, and if at that point they feel you are a candidate for medical cannabis, they will then prescribe it to you. After you're prescribed medical cannabis, you visit with our educators. We call them Canna Geniuses. They cover everything you need to know about medical cannabis, how to use it, how to stay legal with it, where you can obtain it, how you can obtain it, and they will even walk you through the registration process so that you can actually just walk away knowing or feeling confident in it. So after your Canna Genius visit, it's from 10 minutes to 5 business days. Your LP, or licensed producer, one of the individual companies that we sign you up with, will actually register you, contact you, and let you know, okay, you are registered, go ahead and order, and then you can finally get your medical cannabis. The medical cannabis system, you can only order either by phone or online, and it is mailed directly to your door. So for some people, they wish they could go to a store and touch and feel and smell, but if you're looking for medication that you know just works and arrives on time, medical cannabis is for you. We are Harvest Medicine. Does anybody have any questions? I'm sure I kind of burned through that a little quick. Right up front.
Quick one before I forget. With the oils, is there, if you're taking the oils, are you going to have any off odor of the cannabis?
No, just in case Mike didn't hear it. Are there any odors from the cannabis oil? Some of the oils do have a slight odor to them, but at no point would it reek up a room or anything like that. And even some oils are very subtly smelling, and just a couple drops in your smoothie, you wouldn't taste it, you wouldn't smell it, nobody would be the wiser. Any other questions?
Hey, hi, I was really curious to see, like you say, in the late 20s, early 30s, what kind of conditions or symptoms or illnesses are you managing? In what way, for what reasons would you prescribe it for that age group?
There's a number of reasons. Some of the most common ones we see for the younger age group would be anxiety, depression, and in my personal case, insomnia. The first year I was on medical cannabis, I actually managed to lose 100 pounds just because I was able to sleep through the night.
So related to that then, what's your information on use of medical cannabis for sleep apnea? Have you investigated that?
I'm going to direct you to Faraz over here.
So when you ask about sleep apnea, it's funny because I actually just finished talking to a patient right before coming in here today. When you're dealing with insomnia, certainly there's more of an organic cause within the psyche that's causing that issue when it comes to sleep. When you talk about sleep apnea, you deal with two things. There's a physical cause and then the anxiety that builds up around it, right? Generally what happens is when you're dealing with sleep apnea, you get hooked up to the CPAP machine, right? That's the best treatment when it comes to sleep apnea. We have actually found, and this has been going on for years, that people that are using a little bit of THC at night with their sleep apnea machine are more likely to be compliant to their CPAP. So it makes it more comfortable. I mean, you're dealing with the mask over your face, and I don't know about you guys, but when I'm sleeping and anything covers my face, I get nervous and I get a little bit stressed out and get anxious. Having a mask while you're sleeping the whole night, people tend not to keep the mask on through the whole night and then have these variations in their REM cycles. When you're able to use the THC, it makes it more comfortable, it makes it more manageable, and therefore you're able to be a lot more compliant with the mask and therefore able to sleep better and possibly lose that weight so you're not constantly on that CPAP machine. So that's a big part of it.
So for the other aspect of it, the anatomical aspect, is managing the anxiety of CPAP is fabulous, and I know that works for people, and it just gives them some confidence that they'll be able to manage it and have a good outcome over the long term. But what about someone with moderate sleep apnea who isn't using CPAP? Does it have any effect in inflammation of the throat tissues or anything anatomical in that area that might help?
So a lot of times when it comes to obstructive sleep apnea, you're dealing with two things. As you said, the anatomical one and the inflammation. What the source of the inflammation is a big cause of it. If it is an anatomical reason for it, whether or not it's increased weight, whether or not it's weak ligaments, weak muscle structure and all that, yes, CBD does have a benefit in the sense that, yes, it helps with weight loss. It helps manage the inflammation. When you are in a stressed state, you get increased inflammation. As you're getting that lack of sleep, inflammation increases. So CBD will help control that inflammation to prevent that inflammation from becoming a lot more progressive and creating more of an obstruction. So when it comes to that, definitely CBD plays a role in helping decrease the musculature or the weight on the neck and therefore helping manage that long term. Is it going to be as immediate as with the CPAP and THC? Not by any means. It does take time. Right? Inflammation over built up period of time takes time to reduce. So that's where it is a little bit of a longer process if they're not directly on a CPAP, right? But generally, I mean, if you're looking at moderate to severe, you're looking at, again, starting interventions and stuff like that, right? So that's the key. Yep.
Okay. I've been a prostate cancer survivor, if you will, living with cancer for about 12 years. I differentiate very significantly between BPH and an early diagnosis of prostate cancer. And one of the issues with prostate cancer is that it can be in the body and can be asymptomatic for a very long time. Now, one of the concerns I might have for those that are taking the CBD, what have you, for an inflammation, is that you may be hiding the symptom that in fact signals that you should be going to your family doctor for a digital rectal examination and for a PSA test. Am I correct in thinking that this anti-inflammatory condition or result might delay the onset of symptoms that signal to a guy, I better get in there? Because we don't want to delay that. We don't want to delay early diagnosis.
Oh, and that's the key. When it comes to prostate cancer, the key to it is, again, lead time diagnosis, right? The earlier the detection, the better, right? But as you said,
it's not just you, there's a majority of the patients with prostate cancer that tend to be asymptomatic. And they develop two things. They'll either find a high PSA, right? Or they're gonna find a little bit of hematuria, so a little bit of blood in the urine, right? The key that you have to understand is that when Flomax is started, or when Terazosin or any of these medications are started, they're generally started after BPH has gotten to that obstructive stage. By no means is it started prior to that stage.
But I want to move you into the cancerous condition as opposed.
Agreed. And when it comes to the cancerous conditions, right? Again, when it comes time to actually starting some of these medications, right? You're not using this as a treatment for the cancer, right? You're using this once you have the diagnosis of the cancer rather than preventing the cancer. And that's the key that comes up, that it's not about just the inflammation itself. Yes, the obstruction is a symptom that signals you to go see your doctor. But a lot of times it is actually a finding when they're doing your blood work and all that, when they're doing your digital rectal, that they find a positive PSA.
So is your clinic actively involved in providing digital rectal examinations?
So we're not there to do your digital rectal. What we do though is monitor your PSA. The number of people that are actually positive for a digital rectal when it is cancerous is very low, right? The digital rectal is primarily there for if you're getting BPH. BPH tends to be the one where you get hyperplasia of the prostate. When it comes to prostate cancer, you're not generally large, you're generally hard. And that's where the digital rectal is key, but more importantly, following up with your PSAs are the major components. Once you see that consistently high PSA, that's when we realize, okay, there needs to be a component where either a biopsy or management needs to be considered, right? So when we get you into the clinic, we're not there to make that diagnosis for you. We're there to follow up on the PSAs, and yes, if there's a PSA that we're concerned about, we refer you and tell you, check with your family doctor to make sure that this is a viable treatment option. As I said, when it comes in, we're not there to just give you the medications. I think there were maybe 3 or 4 patients today that I said weren't a candidate, right? This isn't a treatment for everyone. But at the end of the day, we are there to try and do things properly so that we're not hiding something, pushing you into something, or going to create problems in your future life. And that's why we keep track of your PSA. I know I had a patient last week that I think I talked to Dave about that we're looking at, again, management of the symptoms. Right? His symptoms were more prolific in his case, so CBD, would play a part in his treatment. But again, we told him, keep a close eye on your PSA. We're not there to treat, we're there to manage the symptoms, but you're still following up regularly with your family physician and your oncologist to follow up on the PSA values. So yes, we're there to help with the inflammation, help with the symptom control, but we're also there as an advocate of your health. And we don't want to put you in a situation where we are taking away from your overall health and well-being.
Good. At the other end of just one other point. At the other end of the disease, once it's invaded lymph nodes and bone, that's a different condition and state. What's your experience in dealing with the pain associated with it?
And that's where, as I was saying, that it's nice when it comes to CBD and THC combined, right? At that stage, it's no longer just about the symptomatic control of the urinary symptoms, problems with that. It's far from it, as you said. At that point, you're dealing with pain management. And that's where it's really nice to have THC on board, and it's really nice to use a combination of it, right? CBD, yes, does create a long-term pain control because it decreases your inflammation, it decreases anxiety. One thing about pain is that it's a double-edged sword. Right? It not only is a source of the pain, but the anxiety about the pain, right? So when you treat the pain, you still have that anxiety about it, and you're waking up every morning thinking, am I going to have this pain? That's where CBD is nice to help manage that anxiety. THC, on the other hand, is great for helping control that pain. When you're decreasing that pain, the anxiety about the pain comes down, right? As I said, we're not there as a treatment, right? We're there as symptom control, and it becomes a matter of quality life at that point. And THC is great for managing the quality of life and helping provide that care for you so that things can be a little bit more manageable and you can stand the symptoms. So.
Yeah, two questions. Harvest Medicine has a number of suppliers, I imagine. How does Harvest Medicine monitor the quality of the product? And a secondary question, how closely does Harvest Medicine work with your family doctor? Do you have to deal with the family doctor or not?
I'll answer the second one first. You do not need to include your family doctor, but right on one of our intake questionnaires, we ask, would you like your family doctor to be informed of your care at Harvest Medicine? If you choose yes, we will send over your entire encounter to your family physician so that they are well aware of your entire treatment. As for the suppliers, the testing is actually all done through Canada Health. We do not touch anything. We never have product in store, anything like that. So Health Canada actually mandates licensed producers to give up 10% of their entire yield for testing. So it goes through the gamut of every single thing they could test for, they do, and they approve it for sale. We sign you up with a licensed producer. We have a short list of, I believe, 12 because we know they have great customer care. We know they have enough product in stock. We know that, just they're going to be able to take care of you appropriately. So we, say these are our preferred. We give you a questionnaire when you first sit down with our genius to help narrow down where or which LP might be best for you. So is cost a factor? Is selection a factor? Is shipping time a factor? And we can just break it all down, give you a what do you like, A, B, or C, and you can kind of make a more educated decision in that way. You're very welcome.
THC used at night is fairly persistent in the system, perhaps more so than alcohol. With legalization of marijuana, there are going to be, at some point in time, a defined max limit for THC in the blood while driving. Can you...
Yes and no. Because THC is cumulative in your body, and like somebody like myself who is a heavy user, if I were to have my blood taken right now, I would be well over any kind of legal limit, but I am in no means impaired because I didn't have anything today. What we are seeing actually is some new technologies coming out. The most common one I believe right now, the one that they're actually trying to push through, is the mouth swab. So the mouth swab can actually recognize if you have smoked cannabis within the last 2 hours, and the benefit of the mouth swab as well is that you cannot deny a mouth swab. A blood sample is invasive, and you can deny a blood sample, so they would take you to the precinct and make you wait, and your blood alcohol level decreases. With cannabis, they can swab your mouth right then because it's non-invasive, and they can actually make sure that the streets are safe.
And it's not picking up residual from use 2 days ago.
Exactly, yeah. Next.
Can I ask how that works then in terms of like drug testing for employers? I know you were talking about THC.
Yeah, so we will provide a medical document for different employers, and we will also inform the employer of how we educated the patient. So we never recommend THC to be a daytime use, particularly on the job, but if their prescription is for CBD, we might even just share the restriction if that is requested by the patient, that we share that so that we can prove that the patient in no way can obtain something that would impair them.
So you can get CBD in a separate form to THC, and you can get THC in a separate form to
the CBD, and you can get them combined. Yeah.
So for somebody who prostate cancer, who's metastasized, who is looking for pain relief,
you're going to probably want a THC-heavy 1-to-1. So you would still want some CBD for anti-inflammation properties. You're probably looking for a little bit of the mind separation from the pain.
why, and anti-inflammation?
Yeah, so CBD can help with any inflammation that's causing pain.
In the bone?
Just generally. So one of the most common reasons why people actually come in is because of joint pain, whether or not it's rheumatoid or osteoarthritis. So it does play a certain factor when it comes to pain control within the bone, surrounding the bone, within the musculature. So as I said, there's two components. One is the inflammation itself, and one is the anxiety. And that's where CBD is nice because it does well to control that inflammation, right, wherever it may be. Anytime you get pain in the body, it's because of a certain amount of inflammation, and we get our white blood cells releasing those certain chemicals to cause that pain stimulation and that inflammation. What CBD does is it actually helps treat that underlying inflammation, right? Not necessarily treat the underlying pathologic process, whether or not it is cancer or not, right? But it does well to decrease that inflammation so you're not being stimulated by that pain so often, as well as helping manage the anxiety about that pain. So it does well to control that pain long term, right? Whereas THC is more, again, with that acute pain control, and as my colleague has said, with dissociating from that pain and helping you cope with that pain a lot better.
Just as a follow-up, if you take it with both, like part of both, and presumably you take some of this daily, is there a time during the day when it's the best time so that you can still drive? Or if you're on this medication, basically you're off limits to go to drive?
We actually break it down for you. So with ingestion, it takes about 1 to 2 hours to actually feel the effects, and then they last for about 8 hours. So if you're taking an oil, you might have a few minutes, you might be able to, get home or get to the corner store, but for about 8 hours, you will be medicated. If it's with CBD, it will be non-psychoactive, but if it is THC, you will be high for that amount of time.
But then after 8 hours, it wears off.
Exactly.
So you're back in pain.
But see, that's why, again, when it comes to cycling that's why we always use a combination, right? For daytime use, we always say use a CBD because you're able to function, you're able to stay mobile, you're able to stay non-impaired, right? THC has, depending on the dose, a certain level of impairment, right? Whether or not it is that 3 hour period or that 8 hour period. Yes, when it comes to any type of pain control, whether or not it's your morphine, Dilaudid, anything like that, after a certain amount of time, it wears off. I think you're sitting pretty if you're sitting at around 12 to 15 hours, and that's what the naproxen and stuff like that, tramadol, ketorolac. But when it comes to Dilaudid, morphine, and stuff like that, you're looking at short time periods, and we're looking at 4 to 6 hour intervals. The nice thing about THC oil is it can last from anywhere between 6 to 12 hours. So you're getting a good amount of pain control, and that's why we also suggest using it at night. Because the best thing about sleep is it can repair and allow you to cope and decreases these stress hormones to allow your coping mechanisms. So yeah, CBD oil through the day, THC at night, or if you're not having to worry about travel and all that, yeah, you're able to use that 1-to-1 during the day. But again, we might look at your dosing throughout the day so you're not getting a huge level of impairment and sedation, but then increasing your nighttime dose so you're getting enough sedation and pain control to last through the night. And that's why we always look at a dry herb as an option too for acute pain control, as well as the oil. That the onset of the dry herb is a lot quicker than the oil, right? So a lot of times what we use for what we call abortive therapy is that dry herb. So that when you're getting that acute onset of pain, you're able to get a quicker onset, but it's a shorter duration, right? So when you're talking about the herb is quicker to act, shorter duration. Right? Whereas the oil can take a little bit longer to act, but you're looking at a lot longer duration of pain control and symptom control.
And the herb would be vaporized.
Exactly. And that's why we try and keep it at the vape, because you're able to activate the terpenes at the right amount so that you're still getting a significant amount of pain control.
So would some people take both, a combination before they go to bed, perhaps then just have the CBD in the daytime, and if they need something else for the pain control to allow them to stay active and get out, take something else for that.
So what I actually talked to this patient about last week was, again, we ended up doing all three. So CBD throughout the day for symptom control, long-term inflammation, and pain control, right? But when there were prolific amounts of pain, then to use that dry herb, right? And that, again, allowed him to deal with the pain, allow him to cope, right? Because pain can be very debilitating, right? It can be hard on the soul, and then when you're staying at home constantly in pain, it affects your psyche. So that's where that a little bit of THC to allow him to function, allow him to be active was great. And then a lot of times what we actually do at night is use a combination of the dry herb as well as the oil. So the dry herb to get you to sleep, to do that initial pain control, as well as the oil to keep you asleep and maintain your sleep through the night. And that's a nice combination that we do use for some patients that are in a lot of acute pain.
And how often do you see patients? I mean, you come in, you prescribe something, you think this will work.
Yeah.
Do you expect people to come back in a few weeks to discuss it, and how often would you see people?
Yeah, so regulations by the Alberta College of Physicians and Surgeons means that we actually have to see the patient every 3 months for a follow-up. This is a rule unique to Alberta in the fact that it's only 3 months. In other provinces, the rule is around 6. But yes, we book you for your follow-up appointment before you even leave.
And the good thing is that if you do have any issues, right, we're not there as just a 3 month, right? I've had a patient that came after 2 weeks, right?
Absolutely.
At any time, the 3 month is mandatory. We're able to see you anytime along the process, right? It does take time for some of the CBD to build up and become therapeutic. So we try and say, hey, wait a month, wait 6 weeks for it to come. But if you need to see us, we're there at any time. You're not worried about getting a follow-up time, we're there at any time. Just if it's a phone call, call us in and we can always talk to you too.
Absolutely.
I'm going to bring up finances. First of all of it says here, all of the operation at your place is covered by Alberta Healthcare.
Yeah, so your doctor visit and your education visit is all 100% free.
Oh, and it's covered by Alberta Healthcare.
Absolutely.
Next, you were mentioning that it isn't that expensive, but that's all you said. Like, what's the cost? Is the seniors plan cover it? That most of us here are under, or is this something that we have to look at elsewhere? Our own pocketbook, for instance, and also that is it tax deductible, the prescription medication?
The medication, I'll go backwards again. It is tax deductible, so you can actually claim up to 15% off your entire cannabis medication for the year. And we also include a prescription for vaporizers. So that means that any paraphernalia that you purchased for use with your medical marijuana is also technically tax deductible. Fun fact, because our our owner is a CEO, I found out we can also deduct up to 100% if you're a small business owner. If you're a small business owner, you can actually deduct up to 100%. As far as costs being covered, if you are on income support or the senior, I'm not sure the exact name, there's compassion pricing and things of that nature, which we would just check a box on your registration with the LP, and they would include about a 20% discount for you. As far as it being covered through Medicare or your insurance. Some are beginning to accept it because it does not have a drug identification number, because there's 10,000 different strains. There is no drug identification number, but they are starting to assign a PIN, a plant identification number, and Sun Life Financial is the first outfit we know of that is actually being proactive and covering medical cannabis, I believe up to $5,000. And then you had one more question at the beginning, I apologize.
Well, it's sort of involved, like, what is the cost of your, say?
2 milligrams a day would cost roughly how much?
Okay, 2 milligrams a day. I know the elixir is $89 and has 900 milligrams in it. So at 2 milligrams a day, that would last you quite a while. Generally, we see about $100 per month as the cost associated with it. Whether a little bit of that is negated because of the compassion pricing and then because of benefits. But generally, I think what you're asking is how much will I be spending on this every month? Generally, we see about $100. Different oils come in different concentrations and different sizes. So what we actually do at Harvest Medicine is we have a spreadsheet where we break it down to your medicine per dollar value. So when I talk about the elixir, it's actually a mist that you can squirt under your tongue, and that comes out to 11 cents per milligram of CBD. And when you compare that to the best priced items on the market, it's right up there, and it's just discretionary value is, you can't compete with it if that's something you're interested in.
Yeah, sorry, that pricing, is that for CBD and then it would be the similar pricing for the THC?
They are generally around the same, yes.
I mean, you're looking at a very subjective question because everyone has different susceptibilities. Everyone will have different needs. When you're looking at that 2 gram a day generalization, again, it's based on how much you're needing to go through, right? I mean, most people that are new to it are going to be pretty susceptible to it and will probably need a reduced amount, right? So when you're looking at the dosing and all that, that plays a factor into it. Need plays a factor. Long-term use history, all those play a factor. So that's where we can factor that in.
It's like all prescriptions.
So that's what I mean.
But, like that's where I'm saying, give us an example. 2 milligrams a day, is $100, you're saying, and that would last 45 days. You're viable for $100. Okay, and so that's what you're looking at, and so that's what I'm saying. Like what is the cost? If I take it for pain, from pain, that's a lot more than me taking Tylenol.
But you're also going to get a lot more effective pain control. You know what I mean? Like when we talk about THC pain control, you can't compare it to Tylenol, ibuprofen, stuff like that. You're comparing it more to your morphine-allotted pain control, right? And the pain control that some people get from some of the opioids is a lot greater than what they get from Tylenol, right? But then if you look at it, I mean, we can talk about IV Tylenol, right? And that's the best pain control. But you're also looking at $10,000 a treatment. You know what I mean? So when we're looking at quality of pain control versus price, you're looking at something without the addiction. You're looking at something without the side effects that a lot of these opioids have, whether or not it's on the liver, the GI. The GI and the urinary tract are 2 big side effects of opioid. The constipation and the restriction of it can be debilitating to people, right? Whereas THC is not going to give you that symptom too. So you have to look at the risk versus reward and cost versus reward, right? And that's where on a cost versus reward, I think it is a lot more beneficial than the risks when it comes to opioids.
Go over here.
If I understand this correctly, for the cannabis, there's 2 uses. One is to help somebody with the symptoms of, say, cancer, and the other is actually to treat something, like IBS, asthma, the things that I hear on the ads.
So when it comes to treatment, right, you're looking, again, different susceptibility, what the underlying cause is of the underlying pathology or condition. Right? If it is something like IBS, you're looking at something that's more anxiety induced. So CBD does really well to control the anxiety and therefore control the symptoms, right? When you're talking about fibromyalgia and something like that, that is pain, right? But again, the underlying cause is not always certain. So when it comes to treatments, they're looking at antidepressants, pain medications, gabapentin, Neurontin, Lyrica, stuff like that, where again, CBD does well, THC does well. Right?
In the long term, somebody who has IBS, I have had IBS, and I don't have IBS now, but I've controlled it and gotten rid of it through holistic lifestyle and a healthier diet and exercise and all that sort of thing. When somebody comes to you for something that has other causes, lifestyle, diet, inflammation caused by eating junk food and sugar and all that sort of stuff, are they just getting like a Band-Aid sort of solution with this? And what happens when they stop the cannabis? Have the symptoms or has the cause actually been addressed?
See, so now the key that you said there is the diet modifications, exercise, activity, and all that. I actually paid for medical school by working as a trainer and a bouncer and doing martial arts. So training and nutrition is a big part, and that's what my research is actually published in, is nutrition and inflammation. Right? Everything that you listed is there to decrease inflammation, right? So that's what CBD does. It decreases inflammation. By doing your diet control, your lifestyle modifications, you're essentially doing another holistic method, right? And that's what CBD does. It does another holistic method, not to, again, you're not treating the underlying condition as far as there's a big psychological component to it, but you're decreasing the inflammation that causes, right? So yes, there are people that when they take it, will come off of it and won't have any symptoms remaining. It does treat that underlying condition. Your diet, your activities, your modifications decreased the inflammation in your GI, right? And that was the biggest thing. It decreased that inflammation along the process. And that's how CBD is going to function as well, by decreasing its inflammation. That's the number one way it controls the pain long-term, by anti-inflammatory response. So it decreases the underlying inflammation and the stimulation on the GI tract to, again, modify, right? Whereas if you look at the treatment methods right now for IBS, you're looking more at your buscopan, your simethicone, and all that. And all that is symptomatic relief. It's not actually treating the underlying inflammation and cause.
So if somebody is on cannabis to treat inflammatory conditions, they have to keep taking the cannabis in order for that to keep working.
Again, you have to look at the...
As to an underlying cause, perhaps nutrition not being interested.
But see, that's what I mean. When you're talking about decreasing that inflammation through nutrition and all that, are you maintaining the nutrition and lifestyle changes that you had? Right? But that's what I mean. When it comes to actually maintaining that inflammation and keeping it under wraps, yes, there is a certain component where there is a maintenance. You're looking at two things. You're looking at regression, and then you're looking at maintenance of any type of pathology, right? And yes, you're going to have to do some major lifestyle changes in order to get to that regression stage. Once you're in the regression, you're looking at maintenance. You're still maintaining your healthy lifestyles. You're still maintaining your activity levels. By no means are we saying, hey, this is CBD, don't do anything else. I will still make the recommendation, and because my training background is there, I always recommend, hey, look, you're looking at, this is one component of it. We're not looking at a replacement for a lifestyle modification. We're looking at a proponent. This is an adjuvant to other lifestyle modifications to help them get through that initial phase so that we can get them into the regression and keep them at the maintenance. As you know, the initial is a lot harder to get through than the maintenance. Once you're there, the maintenance is there and you're able to maintain it. But that initial symptom control, pain control, and all that is very difficult for some people, right? If it is something that we don't think is necessarily going to be helpful with, right, then yeah, as I said, there were 4 patients today that I didn't think that there was going to be a benefit to them. So my recommendation was cannabis is not for you, right? But if it is something where inflammation and it can be used as an adjuvant to lifestyle methods and all that, as well as your medication, our number one thing is don't stop your medications until you've seen your family physician or another doctor, right? Because when you're looking at it, and I tell all my patients this, you're at baseline right now, and then there's where you are with your current symptoms. The goal is to get you to baseline, and then once we're at baseline, to look at dropping some of the other medications or even CBD in the long run, right? But if you drop all your other medications and you're well below baseline, you're dropping further. And to get you up to that baseline again is a lot more of a climb, right? So that's where you continue your lifestyle choices, you continue your nutrition choices, you continue the medications. But we're using this as an adjuvant to get you to where you need to go, and then we can look at removing agents from your life.
So I think Kelly's ahead of me. Kelly, have a question.
Actually, it's Dennis.
When you take normal medication, you don't have any problems traveling. When you take this medication, am I going to have problems traveling?
If you're traveling within Canada, you will have 0 issues. I can fly personally, because of my prescription level, I can fly with 6 ounces in my carry-on across Canada, and the police can't really say a thing to me. In fact, YYC, they recently implemented a process where they no longer even involve the police because it was just too tiresome for them, and the airport security is able to confirm that you are with a licensed producer as opposed to some gray market dispensary or straight up black market off the street weed.
But you didn't go
Across the border?
Across the border is a no-no. Even though there are legal states, the federal border is illegal to have medical cannabis or cannabis of any kind. So we had a 86-year-old gentleman who is going down to Colorado, and because Colorado is a legal state, at the border they decided to ask him, have you ever smoked cannabis before? He honestly answered, oh, you know, back in high school I gave it a try. Banned for life. So if you are ever going to the States, you do not smoke cannabis, you'd hate the thought of it, just do not. Exactly. When you are in the United States, if you are in a state where it is legal and you can follow their guidelines, absolutely obtain however you need to, but crossing that federal border, never with cannabis at this point.
So I understand you said that there's about 10,000 physicians that are now prescribing physicians. I want to flip that into the situations within hospitals and hospices and the likes. And what is the uptake there of the use of the medical cannabis, particularly with respect to pain control? Because in the hospital setting, they've got a range, and it would seem to me that the medical cannabis, the CBD particularly, could fit in. And if it's economic, would they not do that?
Oh, and you know what? Up to this point, there have been times it has been consistently used when it comes to cancer treatment, along with the lines of chemotherapy and symptom control with nausea, appetite, pain control when it comes to chemo, right? That's been used for ages now, right? It's just that now it's being brought outside to the public sector, outside of the hospital. Now, keep in mind, when it comes to inpatient care, there are also other strict guidelines that they have to follow, right? And without the statistics to prove it, right, they're very hesitant, right? Whereas in the public sector, we're able to use the evidence-based and apply it a lot more easily without having to go through the red tape.
Yeah, do you want some water?
I'll don't worry, you relax.
Oh, okay.
We're here.
So if you could comment on cardiovascular disease as a contraindication in kidney as well.
I'll take these.
Because given that there is decreased inflammation, C-reactive protein, you think it would be actually beneficial?
So the key when I say cardiovascular disease, there's two components, right? When I say cardiovascular and kidney, I don't mean your partner giving you kidney shots to give you a hard time. I mean clear changes in your filtration rate. So that means you're not able to excrete it properly. If you're not able to excrete, if your GFR is low, if your creatinine is high, that means you're not able to function properly, right? Thank you. Excuse me.
And you didn't say CBD, you said heart.
Right? So that's with the kidney, right? When it comes to the heart, the main things that we worry about is any type of arrhythmia, right? We're not worried about inflammation within the heart. Inflammation within the heart is very treatable, right? Whether or not it's myocarditis, pericarditis. The key that we look at is, again, with the arrhythmia control, right? If you have any type of underlying arrhythmia, THC can stimulate the heart rate. Anytime you get anything that can stimulate the heart rate, whether or not it's just going for a workout or something, you always worry about the arrhythmia. And that's what I mean by there are contraindications. Is it your pericarditis, your myocarditis, coronary artery disease? Not by any means, right? It'll actually help vasodilate. It causes vasodilation, it drops your cholesterol, and it also drops your blood pressure. So we're actually able to get people off their blood pressure medication, right? But when it comes to rhythm control, right, we generally have to put them on a restriction when it comes to THC, so we're not hyperstimulating them.
Me? Then what about interaction with ED drugs?
In what way? Like what specifically, which drugs are you worried about?
Well, Viagra, Cialis, Trimix, Bimix.
Yeah, so then as far as that, again, you're not, when you're talking about those medications, you're more worried about the acute onset like nitroglycerin and stuff like that, not mixing those medications. When it comes to CBD, the course of action and the duration before onset is a lot slower than it is with the nitroglycerin. So you're not going to be using CBD like you do with the nitro drugs and the vasodilative drugs. Will it have an effect? Yes, to a certain extent, right? But is it going to be to the point where you're going to be hypotensive and be worried about syncope and all that? Not to that extent. Yes, there are times where you have to be careful when you're using some of these medications, but not to the same extent when it comes to a lot of these nitro meds. Right? Like you can't mix the nitro meds with Viagra, Cialis, and stuff like that because it can cause that orthostatic hypotension. It can cause syncope. Whereas CBD is not going to create that as prolific or as a quick of a response short term. It's more that long-term control. So yes, there are some times where we have to maybe play with the dose a little bit, but it's not going to be, as I said, as prolific as using some of these other medications.
Kurt? Yes, go back to the financial. I'm very confused. You were saying that at the beginning that I understand the cost of the checkup or medical, whatever thing you put through was covered by
Alberta Health
Alberta
Services.
Health.
Yep.
Okay, then you're getting into different costs of the different items. $100 a month. Who's paying for that?
That would be you, or if your benefits provider covers it, like Sun Life Financial is beginning to.
But at the end of the day, none of that money actually comes to the clinic, right? You're going through the licensed providers to fill your prescription. We are there as a vessel to get you the ability to fill your prescription from these licensed providers. Your doctor's visit, all the information that you receive at the clinic, no money actually comes from you to our hands, right? At the end of the day, you'll get the ability to access the licensed providers, and then from there be able to fill your prescription on your means. Whether or not it's through some of the health insurances, whether or not it is through your own pockets, but then you're looking at the tax refunds as a big component of that too.
So it's not like either or the Alberta Healthcare or Blue Cross is the other one I'm thinking of that might cover it. And for me, those are the only two health programs I've got. And if that doesn't cover it,
Yeah, at a certain point it is. Yeah, at a certain point there is a lot of out of pocket, and that's why we do our best to try to help ease that with the compassion pricing, with seniors discounts, with even just pointing out the less expensive products and doing that breakdown of cost per milligram of medicine.
Just to
I'll take
clarify
one
that
more.
point, just to
Sorry,
clarify
Mike.
the point on cost.
Sorry, Mike. I'll take one more question, and then I'd ask if you've got other questions to come up and do it individually.
Is cannabis addictive?
No. I'll let you explain that one further.
Okay, so when it comes to the two components, you have to split them up to a certain extent. CBD, non-addictive, right? THC, again, when you're talking about high levels and all that, you're talking about addiction due to feelings rather than an actual physical addiction. Like, you're not talking about the addiction like you're talking about nicotine, caffeine, which are two most of the addictive products in the world. Right? You're not talking about that level of hormone addiction, right? The levels that we're putting you on THC is primarily there for symptom control, pain control, sleep, right? So we're not giving you, like, I'll let you know specifically, and I actually talked to the medical director about this yesterday. The dose that we actually start you with, which is 0.2 mils of THC, is actually 1/100th of the average THC dose for someone using it outside of the clinic recreationally. Right? So we're talking about minute amounts for pain control and sleep, not to get to that level of addiction where you're worrying about a lot of THC use.
Raz and Josh, thank you very much. I think
Thank
this
you.
has been great. And judging by the number of people here,